All right. Hello, hello, hello. This is the first time that I am going live using StreamYard. So I'm hoping that this is working. We will soon find out. I'm actually going to go to open a new window and go on YouTube to see if I am actually live. Because before I talk, I want to make sure that this is actually working. Okay, it looks like I am live. So I saw this article and it just really touched a nerve with me. It says Medicare regulators confirm woman coded in ER waiting room after 5+ hours waiting for care. So this lady in Wilmington, North Carolina, died basically after waiting 5 hours in the ER. And it talks a little bit about how she presented when she came in. Feel free to leave a comment. If I look to my left, it's because I have two monitors and I can look at the comments on the left. But in today's video, I'm going to be talking about understaffing. And this 77-year-old female went to the ED. She had a BP of 87/53, heart rate of 67, respiratory rate of 30, and she was triaged as the emergency severity level index of 3, which is urgent. I'm not here to judge them. I'm not sure what happened, but they didn't take her back immediately. They left her in the waiting room and she passed away. But my issue with this is that this hospital, after CMS, which is basically Medicare, which is what they get all their money from. So after CMS threatened to terminate their Medicare contract, the hospital began a hiring spree. And this is my issue with nursing. Why do they spread us so thin? Why do they overwork us? So a friend of mine posted this on his page, and a lot of the nurses were bashing nurses, bashing us. We're bashing each other, saying, well, this patient had an ESI of 3. They should have known better. They should have taken her back. That is true. But also, when we are chronically understaffed and overworked, we don't think as clearly as if we had appropriate staffing levels. So magically, after CMS threatens them to take away their money because it's what they care about, they were short 400 nurses. So they hired on hundreds of nurses and they've brought the shortage down to about 100. As this is not just a nursing issue. Patients, you should be outraged. You should be outraged because when we are overworked, your life is in danger. So this is the shorting issue is by far like one of the issues in nursing that I am so extremely passionate about. And this is why I wanted to go live, because in order for me to formulate this and put it in a neat little package, I'm like, no, I'm going to try to go live and just talk about this live now. Um, why why is the nursing profession, we are always to our breaking point? I don't understand. We don't even get breakers for lunch. If you're watching this, make sure that you leave a comment. Let me know what your thoughts are on the shortage of nurses, or if you are a nurse and what you've experienced. So now I'm a nurse practitioner, but when I was a nurse, and I am an overachiever and I want to make sure that my patients are all alive, there's some days where I could barely bring myself to take a lunch, because the thing about nursing is if you step off the floor to go take a lunch, and so technically someone is supposed to be covering you, um, but if they have something they need to deal with, and now it's all on you. And I was always super anxious that if I left the floor, something would happen to my patients. They wouldn't be able to reach me. And that's not how it should be. Nurses should be able to take at least a break. And when we do take a break, we're shamed for it. There was one time where I was working and a nurse had just stepped off the unit to go take a lunch break. A physician comes and rounds on the unit. Thank you, DC, for saying same. Most days I did not take a lunch break. So, a physician had just come on the unit. This nurse had just gone to take a break. and the physician says, "Where's this nurse?" And we say, "Well, she just went on lunch." Tell that nurse to get off her ASS and come back here. We're rounding on patients. That's not excusable. That's inexcusable, right? Physicians shouldn't be talking to us like that. That is ridiculous. And like DC said, this is the norm, right? There may be few hospitals, few and far between, where they're properly staffed, but the majority of hospitals are understaffed to the point where we can't even take a lunch break. And when we do take a lunch break, our hearts are in our chest because we're afraid, like, I really hope and pray that nothing bad happens while I'm gone, right? Um, there was a situation. So my husband only lasted in the hospital about 2 years because of the working conditions, right? So people say, oh, there's a shortage of nurses. Let's focus on educating more nurses. That is not, that is not a viable plan, because education or universities are funneling out students, but as soon as they're out in the world, we're only lasting on the floor maybe 2 years. Everybody's leaving, or they're going to be nurse practitioners. Nobody's lasting. And if working conditions don't change, people are going to continue to die. And the way things are heading after the Redonda trial, now we're held accountable. So God, they were short over 400 nurses. That's insane. That's insane. And yet it's our nursing license on the line, but nobody's holding the CEOs accountable that's making six figures a year. I don't understand. And it's mind boggling to me why this profession is, and they say that we're a respected profession, but it doesn't feel that way, right? Actions are more important than words. Actions are more important than the pizza parties and the free mugs and all this BS that we don't need. So DC says she had to take a break from bedside nursing for months now because my conscience felt overwhelmed with guilt each day. I'd stay late and still felt I couldn't give patients all the care they deserved. Exactly. And the issue is now that they want us to do so much charting. Nursing isn't what it used to be. Now, on any given, like, we'll say even a PCU floor where they should be having maybe three patients, sometimes they'll be stretched 5 to 6, right? So you're on a med tele floor, PCU, we'll say PCU like 4 or 5, med tele, maybe 6 patients. We want to be better nurses. We want to be better nurses, but we just don't have the time. There's so many measures and metrics that we have to do. Nurses for decades, Coranda said that nurses for decades often had no lunch, no coffee, and could barely go to the bathroom. And she can't believe that it's still happening. Love to all nurses. And I think it's gotten worse. It happened when I was a nurse on the floor, and it's still happening. And it's tragic. It's tragic. And DC says, I would rather take a pay cut and have lower ratio of patients so that I could do a good job than get paid well and feel morally wrong for the way patients receive care. Exactly. But you know what? We shouldn't have to take a pay cut. There's another channel that I follow, and this person went live yesterday, and they were talking about the gender differences between male and female, in regards to like male nurses versus female nurses. And the thing I've noticed with men is men tend to be more assertive in regards to, they are not shy about negotiating better salaries. They're not shy about demanding better terms. As women, we tend to be martyrs, and we tend to be like, sure, you want us to do the same amount of work or you want us to do more work for the same amount of pay? Sure. When I was a nurse, we didn't have to do our own lab draws. We had phlebotomists. And slowly, as I was finally leaving to become a nurse practitioner, they said, okay, from now on, you guys will do all the lab draws. You're going to be, also, they had us take the trash out of patients' room at the end of the shift. It used to be environmental services would do that. So, yeah, by the way, you're responsible for all the linens in the patient's room. You're responsible for all their trash. And on top of that, you got to do all the lab draws. And yeah, you're not going to be paid more, even though we've just gotten rid of this many phlebotomists, and now there's that pay that's not going to them, but we're not going to compensate you for that. No, we'll pocket that and put that somewhere else. Another issue is these hospitals, they will continue building and constructing. So they have money to build all these new floors and um, brand new equipment, but you don't have time to compensate nurses adequately. We are not robots. We are not robots. We need to pee. We need to eat. We need to drink. We need time to decompress. We shouldn't feel guilty that if we happen to be at the nurse's station for 2 minutes, that someone's going to come by and be like, "Oh, have you done this? Why haven't you done this? Why are you standing at the hall? Oh, if you're standing, then there's something that hasn't been done." Like, we shouldn't be expected to be go 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 24/7. Like that's an unrealistic expectation. There's so many things that nurses have to juggle, and we're not being used to the top of our uh, practice or our scope of practice. Why are we telling nurses to take trash out? And now, I'm not saying that that is above us or we're too good for that, but what they could do is they could hire maybe have EVS do it or techs do it. So DC says many days I would spend 12 hours doing patient care, meds, blood draws, change garbage, linens, chase around dietary. Just out of curiosity, what state do you practice in? Um, and then she said stay an hour or later to chart everything. And if you do stay late, the hospital doesn't want to pay you overtime. So a lot of times what nurses will do is they'll clock out and they'll chart because they don't want to get in trouble for staying late and for having to pay them more, because then they're under the concern that they're going to get fired. So they're worried about getting fired. So she says Illinois. So I'm in Florida, and across the board, it's a very dangerous place. And again, if you're watching this, if you're just tuning in, I saw an article about a lady that basically died at a facility that was short 400 nurses. And miraculously, when Medicare went to investigate, they were able to hire hundreds of nurses in a very short amount of time, and now the shortage is only down to 100. And you see, she said she'd clock out and she would chart. And a lot of times, DC, what I would do is I would come in an hour earlier before I could clock in. They wouldn't let me clock in early. So I would come in an hour earlier, and I how do I will let me see if I can send you the link through here, because I honestly don't know how to post the article on Instagram. Let me know if you're able to see the article there. I think I posted the link. Um, exactly. So we're coming to work before we can clock in, just so that we can review patient labs, so that we can read doctor's notes, so that once we clock in, we can hit the ground running, because there's so much to do. Let me take you through the day of a typical nurse. You come in. Let me share this again here. I'm trying to share the screen again. So the day of a typical nurse, and again, I'm just talking about a situation where a patient died because a hospital was short 400 nurses. A typical nurse will come in the morning. And like I said, a lot of times we come in early so that we can get a jump start on our day, but we're not getting compensated for that. But I'd rather do that than and set myself up for success than be running around like a chick with my head cut off. I had one manager that actually said we couldn't do that anymore, and I'm like, I just couldn't understand. But anyways, so we'll come in, we will clock in. Usually we have like a huddle, and sometimes the huddle will take a while. Then once we start working, once we get on the floor, we have to get report. And they've changed report now, where you have to do like bedside report. So let's say it's 7:30. By the time you're done with report, it's around 8. You have and that's if you don't have medications, because a lot of times, like, there's insulin, blood draws that like accu-checks that you have to do. And then if there's accu-checks, if you have like 5 diabetic patients, you have to give each one of those patients, make sure you have their insulin with their breakfast. So you're running around that, you're trying to do vitals, you're trying to do your morning assessments. That's just the morning. After you do vitals and assessments for everybody, then you have to sit down and do charting on all of those patients. You have Braden score, the fall scale, patient education, and it's been a while since I've been a nurse, but you start. So, anyways, so Braden Morse, patient education, IPOC, which is like interdisciplinary plan of care. In between that, when you're trying to chart, you'll have patients calling, or you'll have maybe a med at a weird time. You'll have they need to go down for a procedure. The physician is calling you, or you need to call a physician, and the patient needs to go to the bathroom. The patient is in pain, so you have to go. So we are pulled in a million different directions. And then after that, after you're done charting, you do it all over again. You have vitals again, you have assessments, you have meds all day. All day, we don't stop. And that's if your patients are stable. And if your patients are not stable and someone codes, then forget about it. Your day is shot. So every time you go to nursing, most nurses will attest to this. Most nurses will go to work with the knot in their stomach, with anxiety, praying that everybody makes it through the day. DC said that nurses are mediators between the family, doctors, kitchen, CT, radiology, OR, laboratory. Exactly. There's so many things that we do as nurses that frankly shouldn't be falling on our shoulders. Sometimes it felt like telephone. The lab would, like, one doctor would call me. Oh, can you call this doctor and tell him this? Like, why don't you guys call each other? Why don't you talk to yourselves? And then by the time the doctor would call back, the message had changed, this and that. As nurses, again, we have to monitor patients, and we have to look for trends. Is our patient's vitals, are they trending in an inappropriate direction? What did their potassium come back like? Is their potassium critical? And when we are pulled in a million different directions, we're juggling 10 balls, right? And then that 11th ball that's thrown at us, that will be the straw that broke the camel's back. So again, a hospital was short 400 nurses. Imagine how many patients these nurses were held accountable for, or how much they had on their plate. And when we're juggling that much, and when we don't get time to focus on what is actually important, like labs, um, values, what's their cardiac rhythm like? Are they distended? Are they bleeding from a new like site? Um, is something going on? Is something happening? When we don't get time to be with our patients because we're responsible for updating our whiteboards, we're responsible for taking out the linens, we're responsible for charting a bogus or frankly like busy work stuff, that's when patients feel neglected. It shouldn't be patients' faults. Patients shouldn't be saying, "Oh, I'm so sorry to bother you. I'm so sorry to call you, but I need help with this." Like, patients shouldn't feel like they're the burden. We should have enough time that we don't have to be running around like a chicken with our head cut off, right? So, it's very frustrating. And once again, it just shows that why do they do this? Because profit. Profit is what they care about. Even the not-for-profit hospitals, right? They want to make as much money for their, whether it's for their paychecks or whether it's to expand certain departments, build new buildings, build new floors. They want to expand or make as much money as possible with, while paying nurses as little as possible and having as little nurses as possible. Like, nursing should not be the capital. That's not an area where you want to maximize profits and minimize expenditures. That is not the profession to do that, because time and time again, studies show that for each additional patient a nurse has, that patient outcomes decline significantly. We don't have the time to notice declining patient trends. We don't have the time to notice that, hey, this patient just, he has to go to the bathroom, but he's cold and clammy. Maybe he's hypoglycemic. Oh, he looks a little confused. Let me check his blood sugar. When we're so busy, those things kind of like, we're so laser focused, task focused, that the important critical thinking assessment skills that we should be utilizing go out the door. DC said that our hospital spent like $1 million updating the lobby to make it look nice to visitors from the outside. Meanwhile, we have broken and missing equipment in every unit. And that's something that, like, here in Florida, we will have a Gallup survey all the time. And it's so true. Like, one of the survey questions will be like, do you have the equipment needed to perform your job? And sadly, no, we do not. Not having functional equipment available is also a huge issue that wastes time for patient care. Exactly. This is a running joke in nursing, the bladder scanner, right? If you're a nurse, can you drop a comment and let me know what is the running joke with bladder scanners? We can never find them because we'll have like one bladder scanner for the whole hospital, right? So many times I would have to come to work early just to get a working computer. Oh, this computer doesn't work. Oh, this computer doesn't have the O key. This computer doesn't have a working mouse. This computer doesn't have a working scanner. Like, why don't we have the equipment needed to perform our jobs? And like she said, when we don't have enough equipment, not only does it waste patient care, but it jeopardizes patients' health. So I could go on and on with my rants. Um, I now that I know how to do exactly like computers, and isn't it sad? Like, this is not a state issue. This is a nationwide issue because like DC, she's in Illinois, I'm in Florida, and yet we can relate. It's like we work at the same hospital. It's insane. It's ridiculous. So now that I know how to stream my screen plus me, I will do my best to do more lives when things like this. I just want to bring awareness. Nurses, please, please, please advocate for yourselves. Write your legislators. Write your legislators. I'm just making it. I'm just putting this out there in the world in the hopes that maybe someday somebody will see this and like make a change. Maybe a legislator. I don't know, but I feel like if we can be more vocal about the situations that we face, because like I said, as women we tend to be martyrs. We tend to just, oh sure, I'll do that, sure, I won't take a lunch break. Like, we complain about it and we're super passive aggressive about it, but we're not doing anything to be proactive. We're not writing our legislators. We're not standing up to administration, and we just keep taking and taking and taking, and it has to stop. We have to stick up for ourselves, whether it's strikes, going on a strike, or joining nursing groups, your local chapter. Something has to happen. Something has to change, because if it doesn't change, and if you're a patient and you're watching this, if it doesn't change, you're not going to have nurses to take care of you. And I was reading that even some hospitals have like a virtual nurse through an iPad. Like, that's scary. Like, can you imagine like the virtual nurse is like, oh, this patient needs help, but then there's no nurses and it takes however many minutes so that a physical nurse in that building reaches you. Like, things have to change, because if things continue in this trajectory, honestly, I'm scared to go to the hospital. And I did go to the hospital recently and it was an awful experience, but that will be a story for another day. Thank you so much for watching. Make sure that you subscribe. Let me know if you're watching this later, like in the playbacks, if you have any other recommendations, comments, etc. All right. Have a great day. Be blessed. If you're a nurse, I feel you. I I'll be praying for you. Bye.